Hi guys, welcome back to another episode with me, your girl Simone. Guys, this one is kind of personal, and when I say personal, it's me wanting to talk about this little issue that I have been having, and literally as I'm talking to you, I'm having the spasms. Now, guys, I'm referring to sciatic nerve pain. I've been doing some research on it and realizing that, listen, this is nothing to play with. I believe this started when I gave birth to my son. That was 17 years ago, I believe. I had just returned from maternity leave, and I remember sitting down in a meeting at work, and when I was to get up, I could not get up because there was just this significant pain running through my back. But of course, I thought it was because they gave me the spinal injection during labor, and so I thought it was just the residue of it. Anyhow, guys, as the years progress, I noticed I just kept having these back pains, and again I also related that to my bed. So I would change my mattress from time to time because I just could not understand what is causing all this pain. Anyhow, guys, I remember it had gotten so bad I had to go to my doctor, and that was the first time I heard about sciatic or sciatic. I don't know how you pronounce it. Sciatic nerve pain. What it is, guys, is that there is this main artery that runs, is it artery or nerve, that runs through the body, and it basically runs through your spinal cord, and then it kind of pull at the tail end of your spinal cord, or what I would call at the top of your buttocks, so to speak, and then it would kind of like just run off, these spill off from there, going into the buttocks and down into the legs. And I'm describing it like this, guys, and not as a term, because I want you to understand what I'm going through. So somebody may say, why are you sharing this? Well, I'll tell you why am I sharing this. All of what I've seen are persons basically coming up with. Everybody has a solution as it relates to how you can fix your sciatic nerve pain, but I haven't heard anybody talking about what their experience has been. So I am sharing my experience, my experience with sciatic nerve pain. So going back to the story, that a couple of years ago, my doctor, I was having tremendous pain, guys. Sitting down, getting up, the pain was just severe. And the truth is, I'm still thinking about it now. I don't even know if it was as intense as it is now. And I had to go to a physiotherapist. I remember this physiotherapist had put this thing on my back that kind of caused shock waves to have gone into the area. And then we did heat treatment, and then there were several stretches that I had to do. I guess it got better over time, but guys, I think the more I think about it, the more I realize that I've always been having a nagging back pain. But it's the kind of pain that, you kind of endure it because it's not agonizing, it's just annoying. So you've deal with it. So I've been going on and dealing with it, and then I realized, guys, that I think it was in December 2024, I noticed that the pain was intensifying, and today is the 26th of January. The last 2 weeks have been more than I can handle, guys. The pain has gotten so bad, so I'm going to see if I can explain for you the type of pain that I'm having, guys. The pain is sitting like literally, right? If you were to put your finger behind your back, just above your buttocks, there are two little dimples there. If you were to put your finger in there, that's where I'm having the bulk of the pain, guys. The pain is centered in there. And then depending on the time of day, time of night, the pain runs right across my hip, right around to the front of my belly, just above my private area, and it's also the area where my incisions have been, so where I did surgery and C-section, etc. It feels as if the pain is running right in that area, so it's like it has literally encircled my body. And then, guys, it goes into my buttocks, and it goes into my groin, and then it goes down my legs. And it right now it feels as if I'm sitting on my spinal cord. That's how it feels. It feels like there is a point, right? When I sit down, it feels like I'm sitting on a bone, and the pain is just so excruciating. And then, guys, it also feels that the pain is spasmic, if there's such a word, in that the pain it's doing something like it's grabbing, it's letting go, it's grabbing, it's letting go. And then it feels as if it moves to my left buttocks and it squeezes and it let go, and it moves to my right buttocks, it squeezes and it lets go. And when I tell you guys that the pain is excruciating, it gets worse where I find that in the last week, in the mornings when I get up, my lower back is just extremely stiff. And I find that I will get up and I will try to walk, and it feels like there are bones, obviously, guys, in our buttocks. And so it feels like for me to move, for me to walk in my buttocks, is tremendous pain in my buttocks area, guys. It's like the bones, the muscles, as if they're stiff and they do not want to move. And so every movement is pain. If I try to bend down, it's pain. If I try to sit down, it's pain. When I do sit down and can't to get back up, it's pretty painful. If I try to hold on my head or tilt my back a little, like I'm trying to do it now, but I don't want to do it because it's so painful, guys. I've been looking up for what are some of the things that I could do to alleviate, because I realized that the most of the research I've found, the way to heal or to deal with sciatic nerve pain is through stretches. So I've been doing a few stretches, which I notice when I do the stretches, guys, they do relieve me a little bit. And I say a little bit because I will feel the instant relief at that moment. But then the moment I start moving around, guys, I become so stiff and in pain. One other thing I found, that once I do my stretches and then the pain continues, is that if I lie flat and put something firm in that area of my back, you know, that bend area just between your navel, so to speak, and your buttocks to the back. If I put something in there and lie down for like about 5 minutes, that's kind of like tilting, it does provide me some relief. However, I have found, guys, that in order to be able to go through my day, I need to be taking a muscle relaxant. And I have been taking a muscle relaxant so as to be able to help with the pain. But I have made up my mind now that I need to go see a physiotherapist, not a chiropractor. At this point, I think I need to see a physiotherapist, and hopefully the physiotherapist will be able to help me maybe with some more focused exercise, focused stretches, to help with relieving the pain. Now, it also feels, guys, like I feel like it's like an area is inflamed. And why do I say that? Because, you know, when you've had pain to the point where you're sore, that's how my back feels. And I'm talking about my lower back, and then coming to my right side in particular, it's just extremely sore. I can feel the soreness, and I can feel too, like if I make certain turns, certain changes or so, certain twists, I literally feel the soreness in the area. This is a part one. I'm going to do a part two once I see the physiotherapist and we start to see what is it that they're saying. I will share more on it. But if you are dealing with sciatic nerve pain, or you know of someone who has been dealing with it, I would love for us to form a community here. Gather in the chat, in the comment box, guys. Let's talk about it. What exactly have you been using to treat your sciatic nerve pain? Has it been working? Have you been able to totally get rid of it? Because I see a lot of the videos I'm finding, they apparently promise that you can do whatever it is and fully get rid of sciatic nerve pain. It also feels like a pinching of the nerve, guys, but I tell you, there's so many painful emotions taking place that I don't even know what to tell you, guys. It's just pain. It's just pain, and more pain. So I'm pushing through it because I don't like to be sick. I don't want to be sick. I don't want to lose my mobility. I do notice today that my left leg tends to be feeling a little bit on the stiff side. And I don't know if it's because yesterday I went to the pool, because I'm told that, you know, if you do swimming, that can help with managing sciatic nerve pain. Again, guys, I don't know. I'm sharing this from my own experience and hoping it will help somebody else that's going through it. But like I said, I'm looking for a community to gather in the chat box, and let's see if we can talk about it and see if we can help each other, just mentally at least, just sharing what we are experiencing and see where it goes. All right, guys, so I look forward to hearing from you. Thank you for listening. I will bring you part 2 as it relates to how am I progressing with this sciatic nerve pain, and what exactly you could be doing to assist, or what I'm doing, I should say, to assist myself. Thank you for listening. See you in my next video.